People look, stay at home.
Go home and stay home.
Still stay inside.
But just open a window.
Yeah.
Stay home has been the one consistent message we've been getting for the last couple of weeks. Stay home to protect yourself and everyone around you from COVID-19. But what happens when you don't have a home to stay in? My guest today is Jessica Hales, a nurse practitioner who works with people in Toronto who are homeless and who use drugs. And we're going to talk about how this crisis is hitting this population and whether practicing social distancing when you're homeless is even possible. From Global News, I'm Tamara Kandaker, and you're listening to Wait, There's More. Jessica, hi. Thanks so much for doing this.
Thanks for having me.
To start off, can you just give me an overview of the shelter system in Toronto and describe a bit what it's like to live in a shelter?
So over the past few years, we've seen a dramatic increase in the amount of people experiencing homelessness in Toronto. We're also seeing a dramatic shortage of social housing, and this has created a huge backlog. So shelters are full. And for several years now, the city has been relying on respite sites and drop-in centers to meet the need for people who can't access a shelter bed.
Homeless and housing advocates are calling on politicians in the wake of 2 women's deaths on Toronto city streets to provide increased funding for more shelter beds. Last week, Crystal Papineau died after becoming trapped in a donation box.
To just give a sense of the numbers, this past winter, over 1,089 people were unable to access a shelter bed and were instead staying in these overcrowded drop-ins and respite sites.
And what exactly are drop-ins and respite sites, and what are the differences between those and a shelter?
So shelters are opened traditionally year-round, and they generally have access to beds, and they meet shelter standards. So there should be at least 2.5 feet between sleep surfaces. Sometimes shelters are still very crowded. And as a result of just the shortage of shelter beds, we're seeing the shelters themselves are becoming more and more crowded. Like even common areas, say, for example, are now used to have mats on the floor for people to sleep. The drop-ins are just drop-in facilities that during the day function as spaces where people can come in and get food and sort of sit down and socialize. And then in the evening, they transform into places where people can sleep. So they're taking just common areas and laying often mats on the floor to allow for people to sleep, or people are sleeping in chairs.
Yeah.
And respite sites would be something like the new domes that we're seeing pop up on the lakeshore. And the main problem with these respite sites is that they do not meet shelter standards or basic UN standards for the amount of space between sleep surfaces. So people are sleeping literally inches apart on mats on the floor, in chairs, in cots with, sometimes limited access to bathrooms and showers. We see older adults who have issues getting on and off of mats on the floor. So they're sleeping in chairs and their chronic health issues are deteriorating as a result. People in the homeless population have higher rates of things like diabetes, heart disease, even cancer, asthma, and COPD. All of these chronic conditions put them at a much higher risk of experiencing serious complications related to COVID-19. People staying in these facilities don't get much rest. So people are just chronically exhausted and dealing with very high levels of stress on a regular basis.
And what about when people are eating? What are the arrangements with that?
I mean, in the drop-in spaces, they sort of line up for food and they just sit around tables and they eat very close together. The drop-ins are quite crowded because it's generally like one room. So it's one room, sometimes filled with, the one drop-in has like 60 women in a space that could probably comfortably fit about 30 or 40. And people's belongings are also everywhere because there's no storage. So it's quite crowded. So it's a lot of people, a lot of belongings in one big room sharing a meal. And people also hang out in that room. They also sleep in that room. There's really limited amounts of space.
Mm-hmm. It's really hard to stay 6 feet away from the next person, regardless of which part of the system you're in.
Oh, I would say it's impossible.
Yeah.
I mean, in some facilities, it may be easier than others, but the issue is that even if sleep surfaces are 6 feet apart, people are still sharing space. Likely when they're eating, they're still sharing bathrooms, they're still sharing showers, and they're still interacting in that space.
So these conditions sound like the ideal conditions for a disease to thrive. And in general, does disease and sickness spread easily in homeless shelters?
Oh, absolutely. So I think that as soon as I heard of COVID-19 even hitting internationally, I started experiencing extreme anxiety about the catastrophic impact that this could have on people staying in the shelter system, particularly because they have nowhere to self-isolate or social distance. And working in the sector, many of us have seen how outbreaks of lice and scabies and even group A strep have spread very rapidly throughout the shelter system. And we've seen how difficult it is to control outbreaks once they do occur.
For Montreal's homeless population, it's yet another hurdle to survival. Streptococcus A bacteria has been making the rounds in the homeless community. It's a small number of cases, no more than a dozen, but the bacteria could lead to what's commonly known as flesh-eating disease.
So it's basically impossible in a homeless shelter to practice social distancing, but I know that shelters have been doing certain things to make that possible.
Right now we are open to our registered guests only.
That means no new clients will be able to stay even if a current one decides to leave.
As far as our day services are concerned, we've suspended those, which means we don't have people from the outside coming into our shelter.
Kelowna Gospel Mission will continue to serve meals. However, breakfast and lunch will be served outside through their courtyard.
Can you talk to me a bit about some of the measures that shelters in Toronto have been taking, and what's the city been doing to help with social distancing within the shelter system?
Shelters have implemented screening practices for people coming in and out of the shelters. This is a bit challenging because there's not always medical professionals available in shelters, and some folks stay in shelters for quite a while. They're not going out and coming in. So somebody may be developing symptoms, and it may take a while for staff to notice and identify that these symptoms are happening. There is a screening protocol that has been circulated to shelter staff, and staff are screening folks if people are experiencing symptoms of COVID-19. Staff have to email somebody who arranges for transportation to a testing site. So the person is transported to a testing site, and then they are assessed and tested. And then if they are well enough, they are transferred to an isolation site. And at the isolation site, the person will stay there until they get their test results back.
And then if they test positive?
If they test positive, the city is working on developing a quarantine site for people who test positive. We don't know if it's open yet or functioning yet. There have been a lot of challenges, I think, along the road. For example, situations where people who have symptoms have waited substantial amount of times to get transportation to the testing site. And, this is a challenge when shelters cannot isolate people. We need to get symptomatic people out of the shelter as soon as possible. It's been challenging for non-medical staff to implement screening practices within the shelters. Recently, the city has also opened an additional 350 spaces in an attempt to allow more social distancing within the shelter system.
The addition of these new beds, is it actually helping to keep people 6 feet apart? What kind of impact does that have?
It's hard to know because they're not publishing the shelter census. So I think that what's happened is they've opened 350 beds to allow for increased social distancing in some areas of the shelter system. But 350 beds is not enough beds to create enough space to allow for social distancing within the whole shelter system. So there's still areas within the shelter system that are experiencing dangerous levels of overcrowding as a result.
So this current pandemic, how is it playing out in the shelter system in Toronto where you work right now? Has it hit the system already?
Yeah, I would say that in a matter of days, COVID-19 caused further chaos in our community. Prior to the virus hitting, we were already struggling to respond to an increase in overdose deaths and the dangerous shortage of shelter and housing. We already had resources that were stretched thin.
2 out of 3 organizations say the opioid crisis is having a direct impact on staff and the work they do. Livingston says the day in, day out battle to save lives took its toll on her.
You're like in a war zone. Your eyes go dead. You just march along.
And now our agencies have kind of swung in to try to implement infection control and social distancing measures. And as a result, many resources in the community have had to close down, which has created a resource shortage. Because of measures meant to reduce the transmission of the pandemic, many drop-in centers and places that typically support people who are staying outside have closed.
A warming center's closed as of this weekend. Some are suspending volunteer activities. They're also only serving meals to people staying at the shelters. People from off the street can only get meals to go, and many understand why.
Right, and this is on top of the closures of restaurants and coffee shops and libraries and other places where homeless people would usually go.
They're having a hard time accessing bathrooms, meals, places to make phone calls. So even places to wash your hands indoors is a challenge. The other day we saw a situation where many people were waiting in the rain, lined up to try to access takeout meals. So we're very concerned that there is a lack of resources for people who are staying outside, especially at a time when we will likely see more people staying outside. I think the reality is that COVID-19, the virus itself, could cause many deaths within the homeless population, but we're also seeing a huge impact from efforts to reduce viral transmission, so the reduction of services. And I worry that as people become less resourced, more isolated, that we're going to see an increase in the development of chronic illnesses and severe complications of chronic illnesses in the community.
So far, 2 people within Toronto's shelter system have tested positive for COVID-19, but there hasn't been much made public about the cases, aside from the fact that they're not connected and that both people are recovering in isolation. City staff say that they're now trying to figure out who those people came into contact with, but there's no evidence of an outbreak yet in the shelter system. We'll be right back. There's been an overdose crisis happening in Canada for years. You mentioned this earlier. What kind of impact do you think that the COVID-19 outbreak could have on that crisis, and how are these two things now coming into play?
Well, firstly, many overdose prevention sites have had to reduce their service hours and capacity to implement enhanced infection control measures and social distancing. So there has been a shortage of overdose prevention services, and we're beginning to see more overdoses occurring outside. People who use drugs may also be at a higher risk of overdose during periods of quarantine. And the root cause of the overdose crisis is a poison drug supply. So right now, the illicit drug supply contains non-pharmaceutical fentanyl in unpredictable strength in unpredictable amounts. So this means that people don't know the strength of the drugs they're using, and they're at a very high risk of overdose as a result. And it's still unclear how border closures will impact the drug supply. I think there's a lot of concern that it may make our street opioid supply even more toxic, which could result in a higher amount of overdoses. And I worry that as a result of COVID, we will begin to see an increase in overdoses and also overdose deaths.
So there's an affordable housing crisis in the country. There's an overdose epidemic and now this pandemic, which are all coming to a head. And we can obviously talk for a long time about the structural issues that have led us to this point, but what are the immediate solutions that are needed here to save lives?
I think the most pressing issue is the need to move homeless people out of shelters and into hotels and motels where they have their own room, a private bathroom, access to a shower, and are able to self-isolate. I think it's going to be very difficult to practice adequate social distancing or isolate people who have come in contact with others who have tested positive for COVID-19 within shelters because people are sharing common spaces and bathrooms. We also really need to ensure that social services, shelters, and overdose prevention sites have access to needed PPE, personal protective equipment. I think the shortages of personal protective equipment is a great concern on multiple levels, especially because it could mean that certain services won't be able to function if we can't get proper PPE. Right now, even if agencies have the funds to purchase PPE, everything is on back order and it's just impossible to purchase. And we haven't had any real indication for when, the province will step in and actually start providing PPE.
Ontario stockpiled 55 million masks after SARS, but those have since expired, forcing hospitals to compete with the public to purchase more.
We desperately need to increase the amount of drop-in spaces available. We need to make sure that people have places to use the bathroom, to wash their hands, to shower, to get meals, to get shelter during the day. We also need to look at increasing social assistance rates due to a decline in meal programs. People in social assistance need access to be able to purchase food and other necessities, particularly when they're supposed to be self-isolating. So when people have to go out to access meals in the community, they're putting themselves at risk of exposure. We need to work to address the overdose crisis now more than ever. Can't just leave this on the back burner now that we're faced with COVID-19. Overdose prevention services need to be increased. And we need to work to address overdose deaths from its root cause through safer opioid supply prescribing programs and the decriminalization of drug use.
If there is an outbreak within the homeless population, what is the worst case scenario? What are you afraid is going to happen?
I'm afraid that we could see a tremendous amount of deaths related to this virus in the shelter system. I worry that once the transmission picks up, we have already had, I believe, 2 cases within the shelter system. I worry that if transmission picks up, it's going to be extremely hard to contain. And I worry that, I would say, many people, perhaps even the vast majority of people in the shelter system, are at a very high risk of experiencing severe complications related to COVID-19.
Yeah. There's been a lot of talk about this idea that there could be this shortage of medical supplies and we could overwhelm the healthcare system, and then doctors would have to start making choices between one person or the other and who they're going to save. And I know that homeless people already face the stigma in the mainstream medical system. Do you have concerns about that and, whether homeless people are going to be prioritized in that situation, if it comes to that?
Yeah. I mean, of course, across the board, people experiencing homelessness face challenges to accessing medical services. Just in general, in terms of primary care services, they feel stigmatized within the system. They don't have ID. They may not have a telephone. There's just a variety of barriers that prevent people from accessing good care, particularly for people who use drugs. It's very hard to stay in isolation. It's very hard to stay in a hospital if you're experiencing withdrawal. And if physicians and nurse practitioners are not treating drug withdrawal properly, it's going to be a barrier to people accessing needed care. In terms of shortages of ventilators and that sort of thing, from my understanding, decisions on who would get a ventilator will be based on who is most likely to survive. And unfortunately, for many folks in the homeless population, many people are experiencing other chronic health conditions that make them more vulnerable to the effects of COVID-19 that may not work in their favor in this situation.
So everyone's been kind of caught off guard to a degree here, and this pandemic is revealing a lot, or amplifying even more, the inequalities in our society and who's kind of the most at risk in these types of situations. And I was wondering, what do you hope that the public and government officials and politicians will learn from this? And how do you hope that we'll move forward after the pandemic is over?
I hope that from this crisis, governments and communities will learn that homelessness is not acceptable. Abandoning thousands of people in overcrowded shelters is simply not acceptable. And I hope that we will recognize that we must work to end homelessness. And quite frankly, we should start doing that now. In addition to trying to put people into shelters and motels, we should start rapidly developing rent-guaranteed-income social housing. We should expropriate needed properties, use government-owned properties. We should look at building modular housing. We should just really work to get people out of shelters. And if we can do that in a way that leaves them with permanent housing, it's all the better. I also hope we recognize that we need to urgently address the overdose crisis. We need to work with people who use drugs to come up with solutions. And we need to recognize that people who use drugs hold a wealth of knowledge and really need to lead the response to the overdose crisis. And hopefully, we just need to take better care of each other.
Jessica, thank you so much. Really appreciate it.
Okay, thanks so much. Take care.
All right, that's the show. Thanks so much for listening. A few quick updates before I let you go today. The federal government says it's now going to enforce a mandatory quarantine for people returning from abroad starting at midnight tonight.
We have decided that now is the time to make that measure mandatory. I think we all really appreciate that it is so important to have this self-isolation.
Deputy Prime Minister Chrystia Freeland is planning to release more information on how exactly they're going to enforce the mandatory quarantine, but we already know that border officers will be taking down contact info from returning travelers and doing random inspections to make sure that people are staying home. And no one who's going into isolation will be allowed to use public transit to get to their place of isolation. And that was announced right before the government passed the $82 billion financial aid package that we talked about on the show last week. Payments for people who've lost their income are expected to start going out on April 6th. The government says the application process will launch ASAP and that checks will start rolling out 10 days after people apply.
We recognize that is a ways off still, and there are people who stopped working a week and a half ago, 2 weeks ago, that are now receiving their last paycheck and not knowing when the next money is kind of coming in. We recognize that. We're looking for ways to help people bridge through credit or other measures.
There is one change I wanted to make a note of. Last week, we talked about two new benefits the government wanted to introduce, the emergency care benefit and the emergency support benefit. But in the version of the aid package that was just passed, these two things are rolled into a single Canada Emergency Response Benefit. And it's designed to give anyone losing income because of the pandemic $2,000 per month for the next 4 months. Okay, that's all for today. I'm Tamara Kendacker, and I'll talk to you tomorrow.